As we said before the break, your federal counterpart is likely Robert F. Kennedy Jr. I say likely because he still needs to be confirmed by the Senate. He is, as you know, let's go through the litany. He's a vaccine skeptic, or a choicer, I guess is how he prefers to be framed. He wants to rethink fluoride in water. Mixed messages on health policy can have life and death impact. So what impact will he have, in your opinion, potentially, on healthcare here in Massachusetts?
You know, I think our most important thing is to continue to the governor's been really clear with all of her cabinet members that we have a job to do. We're here to represent the values and the what is the best of Massachusetts. You know, we started at the break of how proud I am to work in a state that provides universal access, that is, that follows the evidence, that cares for people in their hour of need, and we're going to continue to do that. I think that we also have to work with our federal counterparts. They fund a lot of the work we do. People are focused on some of the headline grabbing things that you guys are talking about.
Right.
We're really focused on, Medicaid, big funder in the state, is a state-federal partnership. We have a very innovative Medicaid program that's focused on health equity and equitable outcomes across our state. We want to make sure that what we built here that's great persists, and that's our job.
Do you anticipate it could become abrasive if indeed he does get confirmed? And Massachusetts is the center of health research, so what would hostility from Washington mean here?
Well, I think we're going to work really hard to work with our federal partners. I mean, it is a partnership, and think about not only the hospital system, but the research enterprise and the life science industry that we talked about. The cures that the world needs are being made right here or discovered right here in our state.
That's where the impact could be.
That's where some of the impact could be, but I think we're going to work really hard to do our jobs.
All right, the impact of opioid abuse in Massachusetts considerable. Are we still, do you think, in the crisis phase, or is progress being made?
I'm very happy to report that we have seen a drop in the fatal overdoses, but this is still a very difficult.
How significant?
Difficult, 11%, I think, over the last year. We should fact check that number, but I think under the hood of the very good news is the fact that there are still inequities by race, ethnicity, and region that we're working on with the Department of Public Health and our Bureau of Substance Use Disorder to make sure that Commissioner Goldstein and Dee Calvert, who runs that bureau, to get grant funding out to smaller community-based organizations so that we can help the people we are not reaching as well. And then I think we have to continue to work on this disease. The most important thing we can do is reduce stigma. People don't recover if they're not here.
You called it a disease. Interesting.
Yes.
Well, got it. Yeah, very good.
Narcan is readily available in Massachusetts.
I think that's a huge improvement.
Without a prescription.
Fentanyl test strips.
Yeah.
There should be no barrier to treatment.
Do you think the general public should make the purchase? Would you advise the general public to make that purchase, just to have it on hand?
At Boston Medical Center, when people left with, say they were a cancer patient and they needed opioids for pain control, they would leave with a Narcan prescription. When I worked there, I carried Narcan because of the neighborhood we were in. I would never had to use it mercifully because I am a civilian, and every time anybody who fell out in front of me, there was always somebody there who knew what they were doing, which was great. But I actually think think about how many people carry EpiPens.
Yeah.
So I carry one. I have a really bad shellfish allergy. I don't eat lobster, but so I think it's really an antidote. The more we can do to help people seek treatment and to reduce barriers to care and to meet people where they are, the better we'll do against this disease.
Secretary Walsh, thanks for your time.
Thank you.
Great
Thanks for being here. It's great to be here.
Are you cooking or cleaning on Thanksgiving?
A little bit of both.
Oh, there you go. Very good.
Yeah.
All right, thanks again to Kay Walsh for sitting in the chair. The Sunday Roundtable is next here on OTR. Massachusetts feeling the heat from the Trump-Musk camp. Mayor Wu, Governor Healy feeling the heat, and OTR playing a key role in that drama as well. We will talk about that when we come back.